Welcome everybody to today's health protection training. You've signed on to the health protection overview training, which encompasses the specialist divisions of environmental health, emergency planning and resilience, and ourselves in public health. So there are some key learning objectives for today outlined and listed below. So we want you to be able to provide an overview of the domains of public health and how health protection fits in, explain the purpose and value principles of outbreak management, outline the definitions of an outbreak and key consideration, understand who the key partners and agencies are in health protection incidents, what are the strategic frameworks and governing legislation in health protection, and then finally we will get you to work through some workbook scenarios examples so you can put this newfound knowledge forward to help with your problem solving scenarios and activities. So that way then you're translating your theory that you're acquiring from myself, my colleagues, Emma Bell and Rachel Humphreys into practice. So I will hand over to public health, which is me.
My name is Christina Gleeson. I'm Public Health Manager here at Luton Council and I work in the Public Health team. So, health protection in the realm of public health. Well, health protection is its own realm in public health. It sits alongside health service delivery and health improvement. And you'll see there on the screen, it talks about health protection. We work at a population level, and this includes the control of infectious diseases, managing emergency responses, and some other environmental health hazards to improve the health of the population through evidence-based, informed, valued practice, and the issue of effect. Really keen to address the issue of effectiveness, efficiency, and equality. And then health improvement, health promotion. What this means is how can we improve health on an individual level and at a population level. So that's the wide range of activities that either Public Health Commission over the life course of public health, so the whole way up to from preconception, pregnancy, all the way up to older age. So very much a life course style of public health. And then it's quite far-reaching as well. So it's all about what determines health. You have your social determinants of health. You want to look at housing. You want to look at employment, social relationships, and as well as monitoring specific disease risks within those populations. So public health is quite far-reaching, but health protection in itself is quite far-reaching as well. So moving on then. The legislation and frameworks which we work to in public health. So in public health, we have our Director of Public Health, and they have a statutory function which is more of a leadership form of function, and they identify and highlight escalating, existing, emerging challenges as necessary. And they also provide advice, challenge and advocacy as well for the local population. The duties health protection are for an upper tier local unitary authority, which is what Luton Council is. They became a secondary mandatory function back in 2013, when powers were extended, such as tackling environmental hazards, which we'll come on to later. So there are some obligations on the Director of Public Health. As I said, it's a statutory role. So the legislations that underpin that would be your Health Services Act 2006, and we also have our Health and Social Care Act 2012. And we take steps, the Director of Public Health needs to take steps to protect local population health by contributing to health protection matters like planning, responding to incidents and threats to public health. And then because we're here today as a collective, there are then other powers that sit in other elements, parts of the council. So we have the Civil Contingencies Act 2004. We also have the Safety at Work Act 1974 and Food Safety Act 1990. And that's why we're doing a joint training with you today. And then just to talk about the Control of Diseases Act 1984, that's the principal act within health protection that we abide by. There was a Coronavirus Act back in 2020, which did give extra powers. We all remember lockdowns, etc., but that has since been stood down. So we're back to the 1984 Control of Diseases Act. So a lot of legislation, a lot of backgrounds and frameworks which we work to, which you'd expect within an evidence-based profession, driving and trying to improve health at a quite a high population level. So when it comes to outbreak management then, we look at it from a risk management perspective. It's very much about identifying risk, prioritize, measure what are we actually looking at, and mitigate what can we do to reduce the impact, ideally take the risk away altogether, or we talk a lot in public health about harm reduction. So we understand that there are some elements of lifestyle in which people engage in that they will continue to engage in, but we just want to have them doing it on in a harm reduction style. So smoking is obviously something, although the government are making great strides in removing that. Alcohol consumption, the whole way up to drug use, etc. So we know they go on, so they often take a harm reduction style to addressing them. So ultimately, we want to identify and control our outbreak. We want to reduce the illness and implications. We very much want to inform future strategies. So what can we do different? COVID learnings from the parliamentary investigation will obviously be paramount to any future pandemics. We want to evaluate the existing prevention strategies. So what is there to prevent or to give people information and understanding on why and what actions they can take themselves to improve their health. So such as smoking, could they vape instead? So that prevention side of things, and from a health protection perspective, very much about vaccinations. So we know vaccine preventable diseases, we have a number of vaccines for them, so they are very much would be classed under our prevention strategy. And again, addressing public concerns. So public concern, it can be concerns within council, concerns within the community, concerns from elected members, concerns from the media. So very much looking at it in a very broad, wide and holistic scale. So what is an outbreak then? So an outbreak is when two or more people having the same disease, symptoms, or exposure to a pathogen in which they are linked by time, space, or contact. So we have one case, it's very rare that we call that an outbreak, we generally call that a situation, but some of you might be aware in the media at the moment with Mpox, it used to be called monkeypox, it's now been changed to Mpox. So Mpox is one of those infections that, depending on the well, we call them clades, but you could say variety, variation, etc., could be a high consequence infectious disease. And with those infections, the clue is in the title, where they actually have quite a high consequence for public health and wider public health. So one singular case of a high consequence infectious disease would have a larger response. So moving on then, it's also important to consider the expected rate of infection, so how quickly it's going to spread within the population. So we think back to COVID, we think of R rate, reproduction rate, different infections will infect and reproduce different number of times. So you go from something like COVID-19, which is about a 1 to 2, 1 to 3 reproduction rate, which is for every one person infected, they can pass it on to 2 or more. And then the whole way up to the other end of the scale, where you have something like measles, which has a reproduction rate of 1 to 15. So that means for every person who, for every unvaccinated person who can get in contact with the disease, they could infect up to 15 others, and then it would multiply therefore forward by 15. So you can see from an outbreak perspective, we would be much more worried about something like measles as opposed to something like COVID from a reproduction rate viewpoint and the ways disease can spread, etc. And then there are similar actions for suspected and anticipate cases, depending on the event and involving microbial contamination of food, etc., food waste, etc. But my colleague Rachel will speak about that a bit later. So who do we work with in health protection? So key parties then, it's everyone really. So we work in collaboration, aiming for goal and outcome from an evidence-based address population and core health need or concern. Health protection at UKHSA, they have released their UKHSA or UXA, which is easier to say, strategic plan, which covers 2023 up to 2026. And they're very much looking at prepare, respond, and build. And they're looking at that both internally within their structure and then the whole way out into the wider health system, which includes ourselves and public health. You'll have your integrated care boards and integrated care system, ICBs and ICSs. You'll have your acute trusts, and you'll have a number of other agencies, animal and plant agency, etc. So we all, water utilities, we all come together to prepare, respond, and build, because it's very much a multi-agency response to things. So UKHSA are very much the lead when it comes to outbreak control and management. So a lot of the expertise comes from there, and they manage the situation centrally. They also will do the contact tracing. They'll be the ones that are in contact with people if they were exposed or to become a case. So that's what happens there. And then from a local level, it's when we have a really complex situation or we need a bit of a multi-agency response to get together to either do a look back or to manage an ongoing situation, but we just need to get everybody around a table essentially before we take that on. So in public health then, the way it works for the team is generally queries, questions come into our public health inbox. So we as a team have a process by which queries come in, and depending on who's managing the inbox, they will respond accordingly or escalate accordingly. So this is our process, and these are the kind of queries that we get coming into us. Noise is notifiable or infectious infections disease pathway. So there is a noise pathway which we can share at the end of as part of this training package. So other areas of the council, you might find that if you're made aware of it, we'd be very grateful if you could alert us through our public health inbox. So that's public.health@luton.gov.uk. We'll have a copy of that in the workbook as well. So yeah, if anything did come in or you were made aware of anything and you're not quite sure what to do, if you contact that inbox, it's monitored 9 to 5 every day. So we'll be able to support you with any help that you may need. So all that looked at, it's now time to put some theory into practice. So at the along with this video, you'll have received a workbook, and there's a set of instructions on that workbook to help you work through the following scenarios. So this is very much the public health scenario. So we have two. So scenario 1 and scenario 2. So if you could open your workbook and work through this example, that would be great. And we're just going to pause here to give you time to do that. So that is scenario 1. Moving on now to scenario 2. Again, this is another public health scenario. Again, please work through this and fill in your health protection workbook. And you will find then a model answer at the back for you. Okay, that is me. I'm now going to hand over to my colleague in emergency planning. Thank you.